My name is Amy, and I'm a respiratory care student, and today I'm going to be doing an ABG today. So for you, I need to make sure I have the right patient in the date of birth that matches with my records. So after I checked my charts, the doctor has also stated that the patient is on an anticoagulant, so I just need to make sure I keep that in mind for when after I get done taking the blood. Alright, so Mr. Jones, today this is a different kind of blood draw. It is coming from your arteries, so I'll be taking it from your radial artery right here. And so this is going to be a little more painful. It's just going to be a sharp pinch in there when I take it. So before I begin, I need to make sure I assess the patient, get their vital signs down before I perform the procedure. And once I am ready, I need to make sure I have all my supplies and my hands are properly cleaned and have my proper gloving on. Once I have my proper gloving on, I need to make sure I have my needle, my name label, my alcohol prep wipe, my stopper for my needle, then my plug there to make sure I don't lose any of the sample, and always have an extra gauze there for the patient. So when I begin, I need to do the modified Allen's test. So I'm going to have the patient their hand out flat, and their patient will normally have something like a towel or tissue paper underneath their wrist there. So their hand's going to be out like this, and so I'm going to have them squeeze their hand about 3 times, and then I will hold the radial and the ulnar artery, and I'm going to release the ulnar once they release their palm open. So I should need to watch to make sure their coloration comes back within 3 to 5 seconds. And if it does not, then I need to check the other arm to make sure their flow is good. So once this arm is okay to use, I need to palpate again, make sure I find the pulse. And I'm going to properly clean the site in a circular motion with an alcohol prep wipe. Make sure it's properly sanitized. And then once I'm ready, I'm going to get my needle ready, and I need to make sure my bevel is up. So I need to have that bevel up with a 45-degree angle like a pencil. So I'm going to palpate again, make sure I find that pulse again. And so when I go down, I need to make sure I am steady and get in there. And once I have it, you should be able to see the blood coming up into the syringe here. So once I am done, I need to make sure I have my gauze ready and hold the blood, or hold the wound site there to make sure it doesn't bleed. And so then I would put it in my stopper, the needle in my stopper here, and I'd push down and I'd dispose of the needle. And so after I'm done holding it, so since they're on an anticoagulant, I'm probably going to have to hold about 10 minutes or more, just depending on when the bleeding stops. And I can always check when I do this. I can look to see if the bleeding has stopped. And then I need to have this Band-Aid on and educate the patient and let them know that they need to have this Band-Aid on for at least 4 hours just to make sure there's no bleeding. And then I will check to make sure they have stopped bleeding. And so when I'm ready, I'm going to make sure I have the patient's label ready. So when I have the patient's name, patient's temperature, their room number, date, the time that I did the test, and then I need to put ventilation, which is if they're on oxygen. So if they're on room air, I need to put 21% room air there. And then also I can put the physician that ordered the procedure to be done. So with the syringe, I need to put the stopper on to make sure there's no air gets into the blood sample, and to make sure there's no clogging no clogs in the blood. So when I'm ready, I need to put that sample into this biohazard bag, and I will make sure I put the label at the top of the bag here. That way it can send off to the patient, or to the lab, excuse me. And then when I am ready, if I'm not quite ready to take it, I can put it on ice, just so that way the blood doesn't start to clot there. So when I am all done, I'm going to make sure everything disposed, make sure I properly place the needle into the sharps container so that way it can't hurt anybody else, poke anybody. And then I will reassess the patient to make sure the patient is okay. I'll get their vital signs. I can get their vital signs and check to make sure they're okay, like if they feel faint, if they need anything else from me. And once I am done, I will make sure everything is clean and out of the way, and report in the charts once I am done that I did with the vital signs and everything. Then I'm good to go.